Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
A new Defense Department Inspector General report finds that the military services have policies for reviewing allegations of abuse at on-base child development centers, but they don't always carry them out the same way. Investigators found inconsistent communication between family advocacy programs and child care officials, leaving some installations without timely information needed to make staffing decisions or update parents. The watchdog warns those gaps can keep classrooms understaffed, reduce childcare capacity, and ultimately affect military readiness. Joining Eric White now to break down the report and what it means for military families is Federal News Network's Rachel Cohen.
So, Rachel, starting from the top, what did the Inspector General find, and what were some of the top-level main discoveries from this report?
So the biggest takeaway is that the IG did not find any sort of widespread failures to investigate abuse claims. Instead, it found that the services do have the policies that they need in place, but what they don't do is administer that review process consistently. It creates a communication and governance problem. So CDC officials, child development center officials who staff the classrooms, talk to parents, that sort of thing, they are often left out of that review process, or they're not told when the decisions are made that affect their staff. So the IG says, those communication issues have a ripple effect. It affects parents' confidence in the CDC's ability to take care of their kids, and ultimately it does affect military readiness.
Yeah, it seems that communication between different committees and different officials is lacking a little bit. For instance, the Child and Youth Program officials aren't included in Incident Determination Committee meetings. Why would that matter? And, I can understand why it would matter, but why does it matter?
When somebody makes an allegation of child abuse at a child development center, the employee is removed from working with kids, which makes sense, while the case goes through the IDC, or the Incident Determination Committee. But the people who actually manage that daycare often don't know when the review ends or what the decision that came out of it was. So that means, in turn, they can't decide whether the employee who's being investigated can come back to work, whether they should be moved elsewhere or, fired entirely, whether they should be replaced with somebody else. Military CDCs have kind of strict ratios of teachers to kids. And so that means even one employee down reduces capacity, right? So that could mean that they have to close classrooms. Waiting lists that are already really long for families get even longer.
We're speaking with Federal News Network DoD reporter Rachel Cohen. One of the problems as well on that front is the review process can take a little while. And obviously you can't have a caregiver that has an accusation floating out there working still. And I'm sure that stressed the workforce even more. How significant of a problem did that cause?
The report didn't really get into how often it happens, but the folks who investigated said that they repeatedly heard at multiple bases that slowdowns do create, real operational issues. And, there's multiple examples that they included where caregivers were not at work for an extended period of time while the centers tried to meet their staffing requirements. And so it's important because, DoD has the country's largest employer-sponsored childcare system. They've got, roughly 210,000 children. And so when classrooms close or capacity shrinks, parents can be forced to kind of call out of work, call out of training, or, have issues if they're called up for deployment. And so that's why the IG really frames this as a readiness issue and not just a child care issue.
When it comes to parents, what did the report speak about their experience? Obviously, you can't have enough transparency and communication when it comes to stuff like this. Is enough of that happening, or are there improvements that can be made to ensure that they are aware of the review of every step of the process?
I think parents anywhere would say that more communication is always better, right? So this report says parents are usually notified when an allegation is first reported, but after that, things get a lot less clear. So CDC staff often can't answer questions. If a parent comes in for pickup or drop off or something like that, and asks about it, the staff don't get updates themselves, right? So that trickles down to parents. And the kind of family advocates don't have consistent requirements for, when to talk to parents, how to talk to parents, that sort of thing. So the IG wants the services to create a standardized guide for parents that walks them through kind of every step of this review process. So not just having kind of a line that says, we take these things seriously. It should really show from the initial allegation through, the various points in the review process, and giving people contact information too. So they know who to reach out to, they know what to expect. And DoD agreed with that recommendation and is looking to implement it by March of 2027.
When it comes to recommendations, what were some of the others, and were there any disagreements from any of the Defense Department entities?
The other kind of main one was about written notification letters after it's determined that there was an incident of child abuse. So the Air Force stopped requiring those letters after they had an internal review that concluded they were sometimes being used for things other than what their intended purpose was, being used in family court proceedings, things like that. And so they decided that, just having a verbal notification, not necessarily in writing, was enough. So the IG disagrees with that and says, current DoD policy still requires written notifications, and the Air Force, neither the Air Force nor the Pentagon had produced any documentation to show that they could do away with that policy or they could deviate from that policy. So, IG says that recommendation still unresolved. The Air Force has been asked to come up with a plan to come into compliance or come up with, another alternative that works. The Air Force says, hey, we're waiting on further guidance from OSD. So there's a few organizations that have to take another few steps for IG to feel like the Air Force is in compliance with that.
That's Federal News Network's Rachel Cohen speaking with Eric White. You can find Rachel's full story at federalnewsnetwork.com.